My name is Dr. Aruna Arora. I am the president of the Medical Association, and we are here for an update from Dr. Harris, well known to all of you as our state health officer. And then today our special guest is Dr. Mimi Munn, and her specialty is OBGYN, maternal fetal medicine, and she is the chair of OBGYN at the University of South Alabama. And so we are very eager to hear from both of you. So I'm going to go ahead and let you speak. Dr. Harris, you want to go ahead and give us the update?
Sure. Thank you very much, Dr. Aurora. And thanks again to everybody for joining us today. We're really excited to have Dr. Munn here. I'm very much looking forward to hearing from her myself. I have some questions for you also, Dr. Munn, that I'd love for you to answer for me.
Sure.
I do want to remind people that we are doing this weekly. This is right now our Thursday 4 p.m. Central Time slot. And so we welcome you back today, and certainly hope you'll try to join us next week as we continue to bring in people who are experts on this topic and can give us the straight answers. So I wanted to give you just a quick update on where we are as a state. We had a pretty difficult week in terms of our numbers of COVID cases this week. We have gone from in early July, a couple of hundred cases of COVID per day and actually under 200 hospitalizations total around the state, to now where we've had more than 3,000 cases a day for the last 3 days. We've had 2 straight days of double-digit numbers of deaths, we're very sorry to report. And our hospitalizations now have gone up to over 1,800, approaching 1,900 people in the state. So that's a 10-fold increase that's happened in just over 4 weeks. And that's a pace that we've not seen before. As we talked to you about before, this has a lot to do, we believe, with the infectivity of this strain of COVID we're seeing now, known as the Delta variant. It's so much easier to spread from person to person than anything we've seen before. And even though vaccinated people aren't very likely to get infected, or if they do, they're not likely to get sick, in most cases, they still can be highly infectious because the Delta variant itself is very, very infectious. So that's quite a concern for us. We are ramping up our ability to do testing around the state. There's quite a demand for testing going on. So not only in our county health departments, but also with some private groups that we're contracting with, we're going to try to make testing more widely available. And again, we're still pushing out the message of vaccination. Everyone age 12 and up is eligible to be vaccinated. We know that people have a lot of questions about whether they want to do that. That's one of the reasons we're here. And so we'll try to answer your questions today. And as always, we remind you, please talk to your physician. Please talk to your child's physician. Please talk to someone who knows you and your family, your medical provider, wherever you get your medical care, to try to get those questions answered. So Dr. Aurora, that was all I had as an update, but I'm happy to answer any questions. So.
That sounds wonderful. And Dr. Munn, you want to go ahead and give us some discussion?
Yeah, I would love to. I'd like to say thanks to Dr. Aurora and Dr. Harris for having me come on today to talk about some of the issues surrounding the COVID vaccine in women, in particular questions surrounding the COVID vaccine in pregnancy, and maybe some questions about what we've seen on the internet as far as rumors about associations with miscarriage and fertility. So I'm glad to come on today and sort of set the record straight. You know, the American College of OBGYN and the Society for Maternal Fetal Medicine, which are the governing bodies that you know, sort of look at these issues and make statements about what to do, have come out very recently with a strong recommendation for pregnant women to receive the COVID-19 vaccine. You know, data is accumulating every day on the COVID vaccine in pregnancy, and so far everything looks very reassuring. There was a study recently published in the New England Journal of Medicine looking at the COVID vaccine in pregnancies that were being followed by the CDC in the V-Safe program. And again, of those 800 and some odd pregnancies that were completed, there appeared to be no increased risk for any adverse outcomes with the pregnancies, no adverse outcomes with the babies, no increased risk for miscarriage. So again, data seems to be very, very reassuring on that front.
Wonderful. And I think just to kind of delve into, you know, a really hot topic right now, especially with adolescents and young people who are really both of those categories are our demographic of people not currently highly vaccinated. So some of the main fears that people have surround fertility and whether or not they
Right.
conceive.
Yes, yes, yes. And that's another big question that we get a lot. You know, back in December, this sort of bubbled up on the internet. There were a couple of folks that were apparently researchers, had been at Pfizer, not even in any kind of vaccine role. I think it was in the respiratory section, research section, who said that the spike protein, which the antibody that you get is made from the COVID vaccine, had some resemblance to a protein on the placenta called syncytin. And so all of a sudden, you know, this stuff sort of appeared on social media that the COVID vaccine was going to make antibodies that would attack the placenta because of this resemblance to the syncytin protein. That was based on absolutely no data. I mean, I never found any studies, and I looked where that was ever reported. You know, again, out of the women, although pregnant women were not enrolled in the vaccine trials, there was probably 40 women who became pregnant incidentally, and there did not seem to be an increased risk for miscarriage in that group. There does not appear to be an increased risk for miscarriage in that group that I just talked about from the New England Journal of Medicine publication. There's actually something recently published by an infertility group, I believe out of Illinois, looking at infertility patients that were, you know, COVID antibody positive, some from the vaccine, some from natural infection. And again, there was no difference in the groups as far as their ability to get pregnant and, you know, remain pregnant. So all the data about that appears very reassuring. One other study that, and I don't think it's been published yet, but some researchers at Yale took 3,000 proteins that are in the human body and, you know, tried to cross-react them with the COVID antibody. And it did not react with the syncytin protein. So again, some very reassuring information that this doesn't attack the placenta, and this is not, you know, going to be responsible for some sort of infertility issue. So, you know, I think women can feel comfortable, you know, getting the vaccine and not, again, no scientific data that it's going to cause miscarriages.
That's a great explanation. How about the women who, you know, have a child and they're breastfeeding and they're worried about getting the vaccine because they
Right.
have these misconceptions that there is, you know, live virus or, you know, attenuated in this vaccine and it's going to cross over and harm their babies?
Right, right. Well, because of the technology, especially with the mRNA vaccines, you know, it's, you know, degraded in a reasonable amount of time. And again, another study that's just recently been published, it doesn't even look like that can be found in breast milk. And they looked at it, you know, 4, 8, 6, 48 hours after, you know, patients got the injection and then were breastfeeding, and that mRNA doesn't seem to be in the breast milk. The good news is there does appear to be antibody in breast milk. And we all know that antibodies, we want that in you know, in breast milk. And that's one of the benefits of breastfeeding. So that's actually very exciting that antibody is transferred to breast milk. So again, only good things seem to be coming out about it, the vaccine and breastfeeding.
That's great to know as well. If you can comment, I know there are even just women out there who are not thinking about getting pregnant and not worried about what we've talked about, but they are worried about heavy menstrual periods after getting the vaccination.
Yeah. This is actually kind of an interesting thing that I saw bubble up on social media, is that a lot of women were reporting heavy periods, or that they had stopped their periods and then had some bleeding after they got the COVID vaccine. You know, I haven't seen anything, you know, published on that as of yet, but, you know, as we were talking before we started going live about an interesting blog by an OBGYN in San Francisco, Dr. Jen Gunter, and she actually did this deep dive into find out, what are vaccines that we've given before the cause of menstrual irregularities? Because it seems like that's not something that is frequently asked in studies that have looked at any vaccine. So Dr. Gunter actually found some data about the HPV vaccine, and that there were some reports of menstrual irregularities after that vaccine. So, it may be that the sort of stress or the immunologic reaction from any vaccine that causes menstrual irregularities. Plus, we all know getting a vaccine is stressful. And, as reproductive women, we know that anytime we get stressed out, that can mess up your period. So, yeah, again, not a big surprise that it would alter your menstrual cycle. So again, and nothing published so far to suggest that that's a permanent condition, that your menses will always be irregular. So again, I think that it is not going to be a big worry. But again, we'll watch for more data to accumulate on that.
Okay, that is wonderful. So just to switch to the known entity of what you have been treating over this past year, and not to fear, not to make people fearful, but just can you describe COVID and pregnancy and what you have seen?
Yeah, the data that started to come out, at the very beginning of the pandemic had us all very, very concerned because, we now know that COVID and pregnancy can result in, worse outcomes compared to kind of non-pregnant counterparts. And that women probably have a higher risk of getting sicker and ending up in the ICU, ending up intubated. So, we're very, very worried about our pregnant patients and the effect of COVID on those individuals. I am kind of concerned about this wave. We hadn't seen this in Mobile before, but we are seeing an increasing number of, young women who seem to be sicker than they were, at our previous bumps in numbers. We have, I think, probably 10 patients in the hospital right now, and there's, a number of them that have oxygen requirements and things that we didn't see before. So, I'm very, very concerned about our pregnant population.
And women who are likely to clot, those women should take this vaccine, right? Because of the conditions that can happen when you get COVID and you have
right. Yeah, some people have talked about the worry with like the J&J vaccine with the thrombocytopenia and thrombosis. That I guess hasn't been as big a problem with the mRNA vaccines. But yeah, if you get COVID disease, that is certainly associated with an increased risk for clotting. And we have seen that, women with big pulmonary emboli and needing to be on full anticoagulation. And so as you can imagine, that's difficult enough in a patient that's not pregnant. Now we've got to worry about two patients. And again, it's very worrisome.
Great. Scott, I want to ask you, how do you think that we are preparing ourselves for surges that could be coming, in the next 3 weeks? I guess some of the modeling out there shows the third week to the beginning of September. What kind of things are we doing?
I would say, first of all, we're pretty concerned about what the next 3 to 4 weeks are going to look like, just because of the rate of increase of the cases. Like I mentioned a few minutes ago, we're talking daily with our hospitals to try to understand what their needs are. Right now, where Dr. Munn is located is really the hot spot for our state right now. A lot of the Gulf Coast of this country, all the way from Texas through Louisiana, Mississippi, Alabama, and into the panhandle of Florida, are really seeing increased numbers of cases, and those hospitals are pretty stressed right now. Mobile has one of the hospitals that has the most COVID inpatients in our state right now at the infirmary. So we understand what situation they are seeing. We are working with them to try to manage the resources that they have. Hospitals are in a lot better place than they were a year ago in terms of things like personal protective equipment, also in their ability to actually treat patients. We have the ability to give antibody infusions to people before they're hospitalized. Thankfully, we do have some treatments that we use for people once they are hospitalized, which can improve their outcomes. And honestly, our nurses and doctors and other healthcare professionals just have a whole lot more experience with COVID, good news, bad news, right? And so they really are doing a great job caring for people. But all that said, I think we really do have some concerns. If we get to the numbers that we had back in January, I don't know that our hospital system can easily handle more than that. That becomes an issue where you just don't physically have space to put people, and you don't have the staff to take care of those people. So we've reached out to our federal partners to try to understand what kind of resources can be available to us. We've reached out actually to staffing and temp agencies that work nationally with healthcare professionals, trying to determine what kind of folks we can have. We're trying to make sure all of our supplies are topped off and ready to go for the surge, if it continues like we anticipate it will. And, the one thing I would just wrap this up by saying is we anticipate all this happening, and yet most of it's preventable in people who are vaccinated. We are beginning to see more breakthrough infections because we have, 1.6 million people fully vaccinated. We fully expect that, we could see a couple of 100,000 breakthrough infections, and that would be exactly what we would expect when you've got, over 1.5 million people vaccinated. But by and large, it's unfortunate, but the hospitalized patients in Alabama beds today with COVID are people who are not vaccinated. And probably most of those people wouldn't have to be there if we could only have reached them sooner and gotten them vaccinated sooner. Remember, if you go get vaccinated today, and if you're listening and haven't, I hope you will go today, but if you go get vaccinated today, you probably still got 5 or 6 weeks to get to that full immunity, because you're going to need, in most cases, with a mRNA vaccine, you're going to need a second shot in 3 or 4 weeks, and then it's going to take a couple of more weeks to really to build full immunity. So vaccinating everybody today still is not going to pay off, for another month and a half.
And so the kind of things that we could do in the interval, the other mitigative measures, the recommendations, rather than, we're not forcing upon anybody, but the mitigative measures that you would recommend in the interval of those 5 weeks would include.
Yeah, so I'm afraid it's a familiar refrain. People are really tired of hearing from me on this, but we've been saying the same things for a year and a half. The state's been really clear that these are not going to be imposed on people. People have the right to make their own decisions, and I totally respect that. I would also say, I hope this doesn't come across the wrong way, but I think there's smart decisions, and then there's decisions that aren't smart, even though you have the right to make those decisions. So the best evidence or the best recommendations we have now are the ones we're adopting from CDC. We think masking makes a lot of sense if you're going to be in indoor public spaces. I mean, I just don't know of a reason you wouldn't want to do that. If you're vaccinated, you're certainly much more protected than someone who's not vaccinated. But really, since Delta can be so infectious, even in people who are vaccinated, if they get infected, we think wearing masks in indoor public spaces makes sense for everybody, regardless of vaccination status. We certainly want to remind people about the normal things with just hand hygiene and respiratory hygiene. I think the single most important piece of advice we can give people, and this applies to COVID, but it applies to everything else, is please stay home if you're sick. Americans don't like to stay home when we're sick. We all think we're supposed to get out and go to work and do our normal things. And hey, I don't feel that bad. I can work through it. And that's really, that's admirable in some cases, but not when we have a pandemic going on. If you're not feeling well, please try to stay home. And then finally, if you're somebody who's really vulnerable to somebody who's really at risk for serious COVID disease because you're a senior, because you have certain chronic health in big gatherings of people, when you don't know their vaccination status, when you have people coming from other places, especially if they're indoors, especially if there are a lot of people there, even if you're vaccinated, vaccination really reduces your risk. But I still would encourage people to be careful if you're one of those people who are really at high risk.
That is really helpful. And I know you've been in great communication with, hospitals, with medical communities, and even recently here with the schools. I know you've been meeting with some school superintendents as well. So can you comment on how we are moving forward in the realm of schools? As in Alabama, we do start schools earlier than most people in our country.
Yeah, so many schools are already in session, as you know. By next week, most all of them will be in session. We've done many calls with the Department of Education and with our superintendents over the past several months. Well, now for the last year and a half, I guess. But we did a call yesterday with well over 100 superintendents from all parts of the state. We are recommending that schools adopt universal masking in schools. You know, that's not an uncontroversial thing to say. You know, many people feel very strongly that that's not the case, that they shouldn't do that or they shouldn't be asked to do that. We are trying to just present the best evidence as we see it. You know, we think masking reduces the risk of transmission of disease. We're thankful that kids, at least younger kids, don't tend to get as sick as other people. If they get infected, they probably don't tend to spread disease as easily if they get infected, although with the Delta variant, I think we're not quite so sure about that second statement there. But remember, schools are, you know, buildings that aren't just full of kids. You know, schools are buildings full of adults as well. The kids who are under age 12 don't have the option to get vaccinated right now. You know, we also have many kids in school now who are just normal kids, but who have serious health problems, and yet they go to normal classes and normal schools like everyone else. And those kids, you know, can really be put at risk. So we've adopted the same recommendations from CDC for universal masking in schools. Many people, you know, just don't agree with that. I respect their opinions on that. The state is not going to order anybody to do that. We're not saying we think it should be a policy of all schools to do it. What we're saying is, if you're a parent with a kid in school, we think the safest thing for your child is for there to be universal masking.
Excellent, I appreciate that. Now, I guess earlier, Dr. Mann, we were talking about just, you know, philosophies and how you've been advising patients over this past year, you know, especially with the beginning of guidance when it was more choice-based, you know, as people were collecting information. And so just, can you speak to the philosophy that you share and how your evolution of thinking has changed and your recommendations have changed?
Yeah, absolutely. I mean, I'm not ashamed to you know, proclaim my own kind of personal take on this, and the journey that I have made in counseling and advising people, you know, is different than you know, even a month ago when the numbers were going down and things were looking promising. You know, one of the reasons why I love the state of Alabama is because we don't force people to do things. I mean, we give people a choice, and, you know, I would like to bring people to the decision that I am endorsing, you know, based on scientific evidence, and, you know, because there's a benefit to it that now, in my mind, outweighs, you know, any risks or potential risks, of which I haven't seen much of them. So, yeah, so I, you know, again, a month or two ago when the numbers were decreasing and patients were asking me if they should get it, I told them, hey, if you're healthy and you work from home and you live in rural Alabama in Chunchula and you're, you know, work from your office and don't go outside, yeah, I mean, you know, maybe not get it right now. I have a totally different take on it now, because again, I am very alarmed by the increasing numbers and the severity of illness. And again, for me, it's science. You know, the risk of what is happening to women is now higher than you know, any worries about side effects from the vaccine, again, of which I have not seen, you know, any. I did something really interesting a couple of months ago. I worked at the Civic Center here in Mobile, where we did some mass vaccination programs on the weekends, and it was so much fun. You know, get to meet people from Mobile that are driving through, and now as part of the medical crew that you know, that observed people and watched them for that 15 to 30 minutes after they got the injection. And I mean, it was a wonderful process, and probably 1,000 people went through my line. You saw nothing, no adverse reactions, you know, not even any dizziness in my line. So, you know, again, my personal experience has been haven't really seen any problems with the vaccine. Haven't seen any pregnant people that I know that have had babies have any issues with it. All I've seen is some really sick women here in my labor and delivery unit, and I am quite frankly concerned. So I'm trying to spread that word and spread that message, that I think now is the time to make that rational decision.
All right, so we're going to go to some of these questions that I'm seeing. We have a question. Are we seeing more hospitalized pregnant women with COVID? And if so, are they ending up on ECMO?
Yeah, well, for us here at South, we've definitely seen an increase in over the past couple of weeks of hospitalized pregnant women for severe illness or moderate or severe illness. We have not had anyone that had to be put on ECMO. We don't have ECMO here in Mobile, so we would have to transfer that patient. And thus far, we have not had to do that. But we have had some very, very sick people, and I think some hospitals in the area have had some maternal deaths even. So it's pretty serious.
Okay, and then what are the pros and cons for unborn children if the mom gets the vaccine?
Yeah, so again, nothing that seems to be a con at this point. Everything appears reassuring in the studies that have looked at the babies. Again, some really encouraging things with the antibody being found in the cord blood, signifying that there can be a transfer of that immunity and those antibodies to babies, which again is only a good thing. Because it may end up protecting the newborn as well. So I've seen, nothing adverse, nothing published adverse, only good things.
And if a lady has had COVID and is now pregnant, will the natural immunity cover?
That's a great question. And I don't think anyone has a great answer to that. And Dr. Harris, I might defer to you to what folks are saying in the non-pregnant community, because I don't think it's clear in that population either. I mean, it seems like we're, recommending vaccine in those patients. I personally think that if you've had a COVID illness and it's been a while, 6 or 8 months, I've seen some data about the antibody titers dropping after 8 months. So I think there probably is some benefit to it. But again, Dr. Harris, if you have some more recent data, I'd be happy to hear it.
Sure. I would say you're exactly right. I don't think we have the data on that condition in pregnancy, on vaccinating people previously infected in pregnancy. I think the numbers are small enough, overall, that we just don't have that, or we don't have them pulled together. Generally speaking, though, however, we do have a lot of numbers on people who've been previously infected, who have then become reinfected, or people who have been previously infected who've subsequently become vaccinated. Our recommendation still is that just because you've been infected before, that's not a reason to not be vaccinated. When we actually look at in the laboratory at the immune responses that are generated, the most robust immune response we see are in people who have been infected first and then vaccinated later. They produce the highest titers of antibodies, and they produce really all of the available antibodies you can produce. And so, there's at least that theoretical concept that maybe they're the most protected. They certainly seem to produce the highest levels of antibodies. But we have had now just under, I think, 5,000 people in Alabama who have been infected at least twice, some even 3 times. And so we know that when you get infected, you do have some protection for a while. We've kind of arbitrarily said about 90 days. We think people rarely get infected a second time within 90 days. Beyond that, though, it's real variable. There's some people who probably are protected longer than that, but there are clearly thousands of people in our state, we know for sure, who aren't protected longer than that because they've gotten infected again. So our best advice right now, based on what we know, is that you not only is it okay to get vaccinated after you've been infected, we actually recommend that you do.
Yeah, and I think I would endorse that for pregnant women as well. Again, knowing that there doesn't seem to be any cons to it so far, and no adverse pregnancy outcomes, and then only potential benefits. So I would counsel that person to go ahead and get a vaccination.
Wonderful. And a question, what about giving the vaccine to a 12-year-old who has not started her menstrual cycle pre-puberty?
Yeah, again, from a GYN standpoint, again, no known effects on fertility. So, you know, from that aspect, from a gynecology standpoint, I don't think there would be any contraindication.
Okay. All right. So now this one, Dr. Harris, you may be able to answer. Can you touch on the death rate of the Delta variant for vaccinated versus non-vaccinated in our state?
Sure. You know, the overall rate is hard to say with regards to Delta variant because we're still not doing a ton of testing to look at which variant it is. We are doing surveillance testing from all over the state. CDC has been doing that for several months. And as of last week, the most recent data, about 80% of our cases over the past 2 weeks have been the Delta variant. So that's what most of them are. Most of them are Delta, but we don't. But these are, again, population studies. We're doing surveillance studies. So when a given individual person gets a case or passes away, we usually don't have the type of variant involved in that particular case. But that said, so that was a long preamble there. But that said, we know that virtually all of our deaths are occurring in unvaccinated people. Since January, the first week of January, now we fully vaccinated about 1.6 million people. We've had about, more than 300, I'm sorry, I can't remember, but between 300 and 400 deaths in people who were fully vaccinated. No, I'm sorry, that's not right. We've had between 30 and 40 deaths in people who were fully vaccinated, as opposed to, you know, the total number of deaths is about 99% of the total. I just don't have the numbers in front of me, but over 99% of our deaths are occurring in unvaccinated people.
Okay. And then follow-up question to that was, is Delta more contagious only, or is it more contagious as well as more serious, severe?
Yeah, the best information we have is that it's not known to be more deadly. It's not known to be more dangerous. There is a little bit of data that suggests it is. There's a study from Scotland that says it might be causing more serious illness. What we have seen in this country so far is that it seems to be about the same in terms of how serious it is, how sick it makes you. But it is clearly much more infectious. You know, with the original strain we had, the numbers we calculate show that each case of COVID would usually spread to 1 to 2 other people. What we're seeing with the Delta variant is that it spreads to at least 3 to 4 other people. Some of the calculations say even 5 other people. So much more infectious. You may have seen the national reports. That puts it on par with about how infectious chickenpox is. You know, chickenpox is a pretty easy thing to spread. So this is much more easier to spread than anything we've seen before with COVID.
And then back to you, Dr. Munn, what about potential to affect future reproductive ability of 12 to 17-year-old girls that are currently being vaccinated?
Yeah, again, there's certainly no long-term data about that, but again, you know, with the discussion that we just had, you know, there is no reason to think that this is going to cause any kind of infertility problems. You know, if women have menstrual irregularities because of it, I don't, you know, there's no reason to think that that's going to cause fertility problems in the future. You know, I'll wait for the data to be published, but again, very optimistic that that it's going to show no adverse effects.
And as you've mentioned, many people have gone on to become pregnant after
the
vaccine. So scientifically, that shouldn't be different here, right?
Absolutely, right.
Yeah. And then I guess in terms of, you know, we know the surveys are showing, you know, having that conversation with the doctor, their own personal doctor, makes all the difference to get the vaccine. So from a doctor's standpoint, how can we then implement having the conversation to directly getting the vaccine into the patient's arm at the time where they are most likely to want to take the vaccine? Have we thought of strategies and ways to, you know, I know we have some you know, limitations based on the actual vaccine, you know, paperwork itself from a federal standpoint, but is there anything that we can do in the interval to, I guess, help our public get the vaccine? You know, but we're telling them to go to their doctors, and so can we then make the transaction happen in the actual doctor's office?
You know, that's a really difficult question. You know, I would say, you know, all of us in medicine, you know, there's a sense in which we're just sort of in sales, right? I mean, you know, we have people who come to us and they're thinking about something, or they're trying to figure out what to do. And, you know, hopefully we're the ones that have the knowledge and that experience to be able to give them good advice. But, you know, just telling them sometimes is not enough. I mean, you do sometimes have to convince people to do things they don't want to do. And you know, much of, as we've talked on here before, I spent about 20 years just being a private practice physician before I started working in public health. And, you know, every day it was, you know, just a long series of one-on-one talks with people going, I really wish you would do this. And sometimes they would, and sometimes they wouldn't. But, you know, that's why you come to see your doctor, right? You come to ask somebody who knows you and understands you, and who hopefully understands what your reasoning is and what your challenges are. The one bit of advice I guess I would give to any providers out there, you know, being hesitant about a vaccine, a lot of times those are just really smart people asking really smart questions, and they just haven't gotten the information they need yet. And so it's really important to delve into why people haven't made up their mind yet. You know, so sometimes it can just be for reasons that you can answer in one sentence, and you've eased their mind. But sometimes it's a lot of other things that the patient maybe can't even verbalize well. And so you've really got to work through that, and you've got to spend some time and understand what their hesitation is and understand what their concerns are. So I don't think there's a simple formula. I think everybody's a little bit different, and everybody, you know, has different thoughts and feelings about it.
Yeah, and if I could just interject, you know, I think making it as easy as possible to get the vaccine is a great idea. You know, we've actually set up a station in our outpatient clinic so that after we counsel a patient and, you know, they're ready to go, all they got to do is walk around the corner and there it is. So, yeah, I mean, I think making it as simple and easy and as accessible as possible is a step in the right direction.
Yeah, definitely. Definitely. When the data supports it, it would be good. Okay, so we've got a couple more questions. Do vaccinated type 2 diabetics have a higher risk for severe disease from Delta compared to a non-vaccinated diabetic patient, I guess?
I'm not, if I understand the question, you know, vaccination with the COVID vaccine seems to reduce your risk of serious illness and hospitalization and death in all populations. I mean, at least to the best of my knowledge. I don't know of one particular study that only looked at type 2 diabetics, but I feel I can very confidently say that if you have chronic medical problems, certain chronic medical problems, and diabetes is on that list, both type 1 and type 2, your risk of getting serious illness or hospitalization or death is much higher from COVID than the average population. And we know that vaccination reduces the risk of serious illness and hospitalization and death. So if I'm understanding the question correctly, if you're a type 2 diabetic, you absolutely need to be vaccinated if there's no other reason not to do it, because it'll improve your chances of staying out of the hospital or worse.
Okay. And then the J&J vaccine is more prone to thrombosis in pregnant patients. Would you recommend the Pfizer vaccine better than a pregnant patient? Better?
Yeah, you know, that the data came out about the thrombosis and thrombocytopenia, and it not necessarily in pregnant women, but that sort of reproductive age group. It seemed like that you know, they had to stop and kind of look at that momentarily. So yeah, you know, what ACOG and SMFM recommend is certainly informing patients of that piece of data about that particular vaccine. If they understand the risks, then to proceed with that vaccine. You know, since we have the Pfizer readily available, you know, I usually the patient opts for the Pfizer with us. But you know, it's not necessarily a contraindication. The patient just has to be fully informed about that piece of data with that particular vaccine.
Okay. Well, I think we've answered most of the questions, and we've gone over what we, said we were going to go over, I think, by 10 minutes. So I want to thank both of you. If you have any closing comments or anything to add before we kind of close up here, Dr. Munn, Dr. Harris.
Yeah, I would just like to thank both of y'all very much for having me on and giving me an opportunity to talk about how important this is. You know, I love and care deeply about, the women of Alabama, and really just want them to be healthy and have good, happy babies and pregnancy. So I appreciate y'all having me on today.
We appreciate you sharing your expertise. And Dr. Harris?
Yeah, thank you, Dr. Munn. That was terrific. It was really great to have you. I learned a lot, and I really appreciate you making time to be on the broadcast today. Just to remind people, we are going to do this again next week, and look forward to being back with you. I hope you'll take time to join us. Please remember, if you've got questions about what you ought to do, please talk to the person you get your health care from. If you want to know what should I do for my health, what should I do for my child, please talk to the healthcare professional who knows you best, and that's the best way to get the information you need.
Wonderful. Well, thank you, Dr. Harris, and thank you, Dr. Munn.
Thank you. Bye-bye.
Bye.